First News with Keeler in the morning on WIBX and WIBX950.com.
I want to switch gears here and go to Dr. Kent Hall, who is the Chief Physician Executive at MVHS, and is on the line now. Doc, good morning.
Good morning. How you doing this morning?
Good. So I want to get an update with where you guys are standing right now when it comes to COVID numbers.
Yeah, so we have 17 patients in the system that are admitted for COVID. Of those, 13 were not vaccinated, 4 were.
Wow. So I just spoke with somebody over the weekend. They have friends who, husband and wife, both got the vaccine, both got a nasty case of the Delta variant last week, and have had some really tough symptoms, but have not gone to the hospital. So that's... is that telling us it may have been a different outcome had they not been vaccinated?
So, I mean, again, it's hard to say when you're only dealing with, 1 or 2 people.
Right.
But in general, I will tell you that, the Delta variant is hitting people a lot harder. And if you're not vaccinated, then you're ending up in the higher levels of the hospital. So you're ending up in the ICU or in the intermediate care. So it is likely yes, but I can't be 100% sure on that.
Yeah.
There is a little bit of a lag on these numbers, but the latest numbers out from Oneida County show 48 cases reported 1 week ago and 44 new positive cases reported on August 10th. I can only get to the 11th, actually the 12th, but I mean, we're back up in the 3 to 4 dozen new cases per day. Yeah, which is not where we want to be.
Doc, when you look at how, so if you put this in a graph, I mean, just look at hospitalizations. You actually in July, I believe, hit 0, right?
Over the 4th of July weekend, we had 0 patients.
And now you're up into the 16, 17 range. We're watching what they say is this is more of a V than the same type of curve that we saw back last year. Do you agree with that?
Well, we're certainly on the upward swing.
Yeah.
Hopefully, we'll get to the pinnacle and then it'll be a sharp decline. We don't know what that is yet. We do know that is a similar trajectory to what the UK had. So, we can certainly hope that. But we at this point in time, we're still going up. So we don't know what it's going to look like, on the when we get going downhill.
CDC now saying almost all of New York State, almost all counties in New York State, people should be masked in public. And I know that's a big topic. So is the vaccine. How long before? What do you think you should be seeing right now? Is it because when you go into a store, there are more people wearing masks than there were maybe 3 weeks ago, 2 weeks ago. But it's still the majority of people are not wearing masks.
Yeah, so I can tell you what I would advise people to do, and that is that when you're going out in public and you're going indoors out in public, that you should wear masks. I think that is the right thing to do for the community. I think it's the right thing to do for yourself. I think it's the right thing to do for your family. Now, I'm not going to. I don't want to make this a political thing. This to me is about decreasing the spread of this virus, especially to those people who are not vaccinated because they can't be vaccinated or simply because they're choosing not to be. I mean, I'm not interested in people getting sick to. Just to show that the vaccines work. That's not what medicine and healthcare is really about.
I want somebody comparing this is the issue of children, and I like to see the signs on people's lawns as I drive by that say "unmask my child" or those sorts of things. As you're seeing, schools are going to start mandating the masks. It's going to happen again in the fall. For not just students, but for staff as well. The comparison this person makes is, most accidents that occur in a vehicle are fender benders. And most times that a child be involved in an accident in a vehicle, it would be in a fender bender. It would not be a serious accident. However, those serious accidents do occur. If the child doesn't wear a seatbelt, chances are they're going to bump up against the seat. Cars are safer today. Chances are it won't be a fatal injury. But there are those rare cases. Do you feel your child is being oppressed by having to being mandated to be in a car seat or a seatbelt? Is that a fair comparison?
Yeah, I think it is fair up to a certain point. Yes, we need to make sure that we're taking care of the people that are most vulnerable and the people that really can't take care of themselves. And I put kids into that latter bucket. So no, we absolutely need to do things in order to protect our vulnerable citizens, and these are members of our community. These are our family members, and if they're not our family members, then they're the family members of people that we know and that we really have strong positive feelings for. So let's do the right thing. Again, this isn't about politics or anything. This is honestly about science. If we all wore masks, as we saw, that we can actually get this under control, even the Delta variant.
Yeah.
So that's my drumbeat mantra for folks is, this is what's good for the community, so let's go ahead and do it.
From one comparison to another, Lance in Lee wants to know, is there some type of a comparison that you can make from catching COVID twice compared to someone who was vaccinated and then gets the virus for the first time? Or does it probably depends on the person, right?
Well, there are a lot of variables there. So it depends on the person, certainly. It also depends on when they got it. And to a very great extent, it depends on which variant they got. If they got the Alpha variant and then they get the Delta variant, the chances of them getting sick is higher than if they got one of the later variants that already had some of the mutations in the Delta variant. So there are a lot of factors there that you need to think about. But in general, you do get a good immune response from having been sick. We do know that. What we don't know is how long that lasts. We do know that the vaccine gives a much higher immune response and that it tends to last longer. Those are the things that we know for sure. And so, which is why I always advise, even if you had the native disease, you should go ahead and get vaccinated.
Well, we had that question last week from someone who said, what is wrong with me going to check my antibodies to see where my antibody level is and then determining whether or not I should get the vaccine?
Well, because you don't know let me answer that in both directions. So, first of all, just because your level is high, that would look like a good thing, but it doesn't tell you what your other immune responses are to know whether that is lasting immunity. The other thing that I would say, which kind of goes in the favor of what the person is thinking, I think, is that actually just because your immune level is low doesn't mean that you wouldn't necessarily get a significant response if you were exposed again. So, it's rolling the dice.
And more rolling of the dice, somebody asking, I've had the virus, I had a mild case, runny nose, slight temperature, and some fatigue, mild case of COVID. I'm not worried today because I feel like if I get it, I'll get the same response. Are we rolling the dice there? What do we know?
Yeah, that's rolling the dice. You can't say that because this was your response the first time that would be your response the second time. It could be better. It could be much worse. We are dealing with a different disease with the Delta variant, and that is something that people need to understand. It may have the same name, it may be caused by the same virus in general, but the reality is the virus has changed enough that this is a different disease.
One more before we go. Mike is in Utica. Hi, Mike. You're on the radio with Dr. Hall. What do you have?
Hi, thank you. Just a quick question. I've been hearing a lot about this booster that they're offering. Mm-hmm. I have COPD. I've been vaccinated twice. I had the Moderna vaccine. Should I consider getting the booster, or what is exactly that going to be for, and what is it going to serve?
All right, I'm going to hang up and let Dr. Hall answer that question. Mike, thank you. Doc, what do you say to that?
So at this time, the booster has been approved for people that are immunocompromised. So if Mike is taking medications for his COPD that may impact his immune system, then he may very well be an appropriate person for the booster. It has not been approved yet for people that have significant comorbidities, but presuming that their immune system works well.
All right. Doc, we'll do this again soon. Thank you so much for your time. We really appreciate it.
Thank you, everybody. Please be safe and have a great week.
Yep, you do the same. Well, it's funny because we've gone through waves in this thing where, well, Andrew, do we need to get Dr. Hall on? It used to be every day, and then we switched to 3 days a week, and that's kind of where we are right now. It almost feels like we're back to that point where it's highly relevant all over again, right?
Unfortunately, yes.
It's really unfortunate.
This podcast is sponsored by Ramp. Are you the decision maker in your company? Consider this. For the first time in decades, there's a better option for a corporate card and spend management platform. Meet Ramp, the only corporate card and spend management system designed to help you spend less money so you can make more. Most corporate credit cards offer points as incentives, but those points amount to less than their worth in real cash value. Ramp's business cards offer you cash back, real money in your pocket. Plus, you control who spends what with each vendor. And Ramp's software collects and verifies receipts automatically, which means you'll stop wasteful spending and close your books in hours instead of days. Businesses that use Ramp add up to 5% to their bottom line the first year. If you're a decision maker, adding Ramp could be one of the best decisions you've ever made. And now get $250 when you join Ramp for free. Just go to ramp.com/easy. Ramp.com/easy. RAMP.com/easy.
Cards issued by Sutton Bank and Celtic Bank, members of FDIC. Terms and conditions apply.